Assalamu alaikum. I am Dr. Rubina A.D. Memon, Professor, Suleman Roshan Medical College, Nawabshah. Presently practicing in the Nawabshah. Previously, I was a professor in the People's Medical College, Nawabshah, and recently retired there and have joined the Suleman Roshan Medical College. Today's talk is on the PCO. That is a very common problem, particularly in the young women. And it is a hormonal problem, and that is characterized by the menstrual disturbance, weight gain, hirsutism, obesity, and infertility. So, what is the cause of the PCO? It is a problem which can occur from 15 to 45 years of the age group. The main actual reason of this PCO is not still known, but there are certain genes has been identified, and that mutation of that genes may lead to this disturbance. The main common disturbance which occur in the hormonal disturbance which occur in the body is the insulin resistance, and that insulin resistance will lead to the diabetes mellitus as well as the obesity. And the second most disturbance is in the excessive androgen level. There is an excessive androgen level in the PCO patient that will lead to the excessive hair growth, so much so that some men may have the hair growth like men, beard and mustaches, and the excessive hairs growth on the chest and all over the body, so much so that they such very difficult socially. And the second common problem for which the patient come to us is the menstrual disturbance. Particularly, there may be the amenorrhea, oligomenorrhea, followed by the heavy menstrual period or irregular menses. Third common problem for which the patient come to us is infertility or subfertility. This is a very common association of the PCO with the infertility. This could be because of this hormonal disturbance. This could be because of the insulin resistance, particularly hyperandrogenism, which lead to the ovaries. The volume of the ovaries will be increased. The characteristics of the PCO, that is according to the Rotterdam criteria, that there may be the clinical or chemical increase in the androgen level, and subfertility, ultrasound finding that shows that there may be the 10 or more small cysts which are peripherally arranged in the echodense stroma, and the volume of the ovaries is increased. So this is the ultrasound finding. Either we diagnose the PCO by the ultrasound, by the hormonal assay, and by the clinically. Clinically, the patient may present to you with the regular menses, the excessive hair growth, the obesity, the fertility. Chemically, we used to do the certain hormones like the FSH-LH. So normally the FSH is more than LH, particularly in the follicular phase. But in PCO, this hormone will be altered, and the LH is higher than the FSH level. There is excessive testosterone and androgen levels, and there may be the hyperinsulinemia. Insulin resistance is also increased. And by ultrasound, as I told you already, that an ultrasound, the volume of the ovaries is increased. There are multicystic ovaries, and there are small cysts in whole of the ovaries, varying from the size 2 to 10 millimeter. This is the finding, or this is the diagnosis of the PCO. What is the treatment actually? Actually, treatment include the lifestyle modification, and ask the patient to reduce her weight. Sometimes the PCO may occur in the thin and lean patient as well. So if the patient is obese, she must reduce her weight. Reduction of the weight will 50% improve her symptoms. And the second is that is the myo-inositol and chirositol. That also help to regularize the hormonal volley in the body. Third is the treatment. Actually, a treatment of PCO is the treatment of the problems, symptoms. If the patient, for example, if the patient come to you for menstrual disturbance, you correct the menstrual cycle. If the patient come to you for the infertility, you treat the infertility. If the patient come to you for the hirsutism, treat the hirsutism. So the treatment is according to the symptom for which the patient come to you. Actually, the myo-inositol and chirositol have the very good results in correcting the hormonal disturbance in the PCO, and this should be continued for at least for the 3 months. And I found that there is a good result. The patient's menses will be regulated, they become fertile, and their weight will be decreased. So thank you very much.